Cardiovascular disease is the leading cause of death globally. And so we're discussing prevention and screenings. Our guest is Joe Vela. He's radiology manager. This is Neighbors Helping Neighbors, the official podcast of Ward Memorial Hospital. Thanks so much for joining us. I'm Joey Waller. Hi there, Joe. Welcome.
Hey, Joey. How are you, sir?
Good. Yourself?
I'm good. Thank you. Thanks for having me.
Excellent. We appreciate you coming aboard. So first, can you tell us, in a nutshell, what's your role at Ward Memorial Hospital, and tell us about the radiology services available locally for patients?
So I'm the Radiology Director here. Been here since 2012. Services that we provide are MRI, CT, X-ray, of course, and ultrasound.
And since cardiovascular disease is so common, as we mentioned, causing 1 in 3 deaths in the US, how important a topic is heart health these days to discuss like we are now, especially when it comes to prevention and early detection?
It's important. I mean, like you said, it's the leading cause of death in the U.S., kills even more than cancer does. And through regular screening, it allows us for early intervention before heart damages occurs.
It seems as though no matter what branch of medicine we're discussing these days, prevention and screenings is a big topic. And yet, no matter how many more people hop on board with that message, it's never enough, right?
People with having high blood pressure, diabetes, things like that, they don't have the full concept of lifestyle change that helps preventing heart disease.
Absolutely. And we're certainly going to discuss that a little bit more in just a moment. But first, heart disease, as you know, Joe, often thought of as more common in men, right? But it's actually the leading cause of death for both men and women. So how important is it to get this message across for women that they pay close attention to their heart health and risk factors as well? Because it may be a misconception that they don't need to be as concerned with it, right?
Yes, because I think in the world it's been always men. It's the leading cause for men, and it's what the same. I mean, it's just the same for female. I mean, they have high blood pressure, diabetes, obesity. Sometimes women being moms and take care of the house. Sometimes they just think the stress of that is what is causing maybe the fatigue or chest pain. Just they think that part is just being the lead in the house sometimes.
And you led me perfectly into my next question. You've already touched, Joe, on some of the risk factors here, and you just mentioned a few warning signs that go along with that. So, what are the warning signs that women in particular should be aware of?
Chest discomfort, shortness of breath. Usually, sometimes it's more common when they're asleep or just at rest, just sitting, watching TV, maybe reading a book. Heartburn and unusual fatigue, and then swelling to the lower extremities.
Swelling to the lower extremities.
Mhm. Yep, legs and ankles.
Okay. When we talk about things, Joe, like fatigue and, just everyday heartburn, people may sometimes mistakenly consider it to be. How do you know where the line is so that being tired or having some chest discomfort, stomach discomfort, how do you know that it's more than something that should be ignored?
I think it's when you take if you have medication like heartburn medication that just to me didn't work, and then just the tiredness. I mean, one even any person should know, hey, they maybe had a week of not sleeping well. That would explain maybe the fatigue. But when they are in a routine and get their 8 hours of sleep, or like a normal person, just regular sleep fatigue, it would explain itself, I guess. It would try to figure, hey, if I'm getting the rest that I need at nighttime, I shouldn't be this tired. There should be a warning, or that should be a trigger to say, hey, maybe I need to get some things checked out.
So if it's starting to worry you and it starts to become consistent, time to get it checked out by a professional, right?
Yes, yeah.
Absolutely. So, Ward Memorial, of course, offers various screenings here, one being calcium scoring. That's offered locally. So, what's a calcium score test for those unfamiliar? And what does it help to identify, actually?
So calcium scoring is done with the CT machine, CAT scan machine, and it measures the calcified plaque in the coronary arteries of the heart, which cause coronary artery disease.
And so, for the layperson, how does that part of the body work? When we talk about plaque there, What does that mean? How damaging can that be if it's not addressed?
There's decreased blood flow. Like you have a artery, think of it as a straw. If you get something stuck on the end of it, I mean, it's gonna take a little bit more of a suction to get your drink through it. So it's kind of the same concept. You get something stuck around the edges. So your heart, it's pumping and you just can't get that blood flow that needs to go through those arteries.
So, who's typically a good candidate for this calcium scoring, and what are some common risk factors people should pay attention to?
So anyone between the ages of 40 and 70 years of age, history, risk factors would be hypertension, diabetes, smoking, obesity, and your BMI, which is your body mass index, higher than 25, high cholesterol, and then just a family history of heart disease.
BMI, body mass index. I think many people hear that term. I'm sure many are familiar with it, obviously. But for those that aren't, what do we actually mean by body mass index?
Body mass index is a calculation that is between your weight and your height. Your local gym will have a machine where you can get on there and it'll calculate that for you.
And there are even apps now and
Yes.
scales that are
Mhm.
digital that enable you to do it at home too, right?
Yes. Yes. Correct.
And typically 25 or under is considered solid, right?
Correct. Yes. Yeah.
Gotcha.
25 or under.
So, switching gears, how about an echocardiogram? What types of heart conditions or concerns can it help providers to evaluate?
Many know what an ultrasound machine is. It's done with an ultrasound like machine, and you create real time moving pictures of the heart structure and function. So the exam can help your doctor evaluate stenosis, leaking of heart valves, heart failure, blood flow, and measuring ejection fraction, which is pumping efficiency.
So, tell me a little bit about that pumping efficiency. What do we mean by that?
So just making sure that your heart is the valves are opening up, everything's an equal amount of blood flow going through the valves when it needs to.
Gotcha. And how about how often there might be a need for both an echocardiogram and the aforementioned calcium scoring, and how do they sometimes go hand in hand?
So your echo and your calcium scoring insurances will look at it as a preventative care for, and so they'll cover it usually once a year. You could get one done as far as getting it covered through. If you go through the insurance, here at Ward Memorial, there is a healthy heart package, if you would, for getting a calcium scoring with your lipid panel, and it also calculate your BMI. But once a year, usually was what insurance will cover, and they work alongside to get a complete picture of both coronary artery disease, the risks in that, and heart structure and function.
Gotcha. A couple of other things for you. Lifestyle. Lifestyle. We hear about it in all branches of healthcare these days. It's the key to so many things being kept in check, right? So when we talk about heart health, diet, exercise, let's take diet first. What's one thing those joining us can do today to improve their diet? Something most anyone can do to take a giant step toward heart health.
Just eating healthier. Sometimes it's easy for us to be hungry, and you know what? A bag of chips sounds good. Fruit, vegetables, things of that sort are better to intake for heart health.
How about exercise? In terms of a minimum amount daily, weekly, what's one thing most anyone can do, again, to move toward a healthier heart on a daily basis?
Cardio. Doing a good cardio workout is really good to do. For me, it's probably the biggest one. It's just plenty of cardio, maybe 2, 3 times a week.
What would you say in terms of exercise would be best and simplest? Is it walking? Is it treadmill? Is it maybe running in place, jogging in place?
As simple as just walking. Just do a daily walk, maybe find a park or something. I mean, here there's a lot of places in cities, towns that they have a walking through a park or just a trail, I feel.
And when we say walk, Joe, we don't mean walk like you're walking to go to the mailbox. We mean walk like somebody just dropped a 20 on the ground and you're running to pick it up before
Yeah,
anybody
yeah,
else
that
does,
kind of
right?
walking. You're not not talking like a stroll in the park. It's more you're at least enough to where you're getting your heart rate up and feeling that you're doing a little workout.
Walking with a purpose, right?
Perfect. Yes, sir.
The
Yes.
purpose being having a healthier heart. So, in summary here, Joe, let me ask you this. What's the biggest message you'd like those joining us to remember about heart health and preventative screens, especially for those people, and you know they're out there, who
Yes, sir.
think, I'm fine. I'll worry about it when there's something to worry about, because then it might be too late, right?
Correct. Yes. I feel prevention starts long before the symptoms. Heart health is built through consistent daily habits. Small changes, like you said, maintain over time, just eating healthier and diet and exercise could help you prevent heart disease and damages to your heart.
Prevention and screening, they go hand in hand with so many things. And of course, most notably, for the purposes of this chat, your heart. Well, folks, we trust you're now more familiar with calcium scoring and echocardiograms. Joe, keep up all your great work keeping people's hearts in good shape. And thanks so much again.
Thank you. Thanks for having me.
For more information, please do visit wardmemorial.com/podcast. If you found this episode helpful, please do share it on your social media. I'm Joey Waller. And thanks again for being part of Neighbors Helping Neighbors, the official podcast of Ward Memorial Hospital.